Welcome to our broadcast, The Path to Be Well, Knowledge and Learning Session. Joining me today is my colleague Paul, and our topic is focused on depression, the factors that go into a diagnosis, and whether cannabis is an appropriate treatment for this condition. You won't want to miss it, so do stay tuned. To all our listeners, we're so happy that you've joined us today. And just a reminder to subscribe to our YouTube channel. You can do that at weedwell.tv. Now, these sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you. And will bring clarity and help you make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this information, so please do them and us a favor by having them subscribe to our Facebook page or join our group at weedwell.group. My name is Mark Tremblay, a founding member of Simcoe Holistic Health and Weedwell. I want to share with you how I became involved with cannabis as a medicine. As a teenager, I did sample marijuana and quickly concluded that it just wasn't for me. I will admit, I did find myself judging those who did consume marijuana, thinking that their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS, and after many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open and my interests further increased. As a result, Simcoe Holistic Health opened its doors in 2013, and since then we have served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Now, having said that, I've also observed that cannabis treatment is simply not for everyone. And for that reason, I want to caution our listeners that cannabis treatment is not a one-size-fits-all. Determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So as I said earlier, joining me is my colleague, Paul. Paul, welcome.
Thank you, Mark, and good day to you. And, looking through the week so far, you've had quite the range of discussions with our audience on depression, and I like where a lot of that went to, and I think we'll touch on a lot of the points, maybe talk about them in a little more detail today. But we'll start with our manifesto this week, and it's I have healthcare choices that enable me to achieve my health goals. And we'll try to tie that in as we discuss today where cannabis might fit in with depression, getting diagnosed with depression and things like that. But what I noticed right away in your Be Clear session, what is depression assessment? And the assessment, there's many of them. We even use one in the clinic, but the assessment is but one tool. And your score on an assessment, on any assessment, doesn't say you are or you're not. Especially in the case of depression, it will require discussion with a psychiatrist, psychologist, people who are trained in this field to make diagnosis. But I just, that was the first thing that I noticed. You were talking depression assessments. Wanted to bring that up. Do you want to share some of the other things you were going over this week so far?
Yeah, Paul. The assessment was a big thing. Primary versus secondary was the other thing.
Yep.
And honestly, I'm really keen and looking forward to your view and interpretation of that as well. The
Okay.
way I kind of summarized it um, is that in the case of depression as secondary, that there would be a dominant chronic condition in your body that caused you to, feel depressed. So depressed was a secondary condition to, the primary condition.
Yep.
That could have been as a result of an injury, an accident that took away your mobility or took away the things that you used to enjoy doing and not being able to do that. That was the topic, I believe, on Tuesday this week.
Excellent. It sounds like it was really nicely done and excellent points, and we'll piggyback off that. Um, Maybe we'll go back to the start though, and we'll actually talk the DSM-5, which is the Diagnostic and Statistic Manual. So think of it like a Bible or the book, and where you're going to find your list of criteria for diagnosis. So depression's in here, substance use disorder is in here. There's a whole wide array of conditions, and this is where you would find, or doctors and whatnot are finding and following along to you check this, you have this, you have this, and how do they come to that? And so, really, I'm just going to read off some of the things that we're looking, or the doctors, the professionals are looking for when it comes to that. And so, we talk about a depressed mood most days, nearly all days, and let's just qualify this before I even go any further, that everyone's entitled to feel sad. If a family member dies, you're going to feel sad. If you've lost your job for whatever reason, you're going to feel sad. This is different depression than we would be talking. We're talking about longer term, months, if not years. And so when we say this happens nearly every day, this is what we're talking about. We're not talking about the sadness that you might feel the days and weeks following a death of a family member, just to be clear. So we talk about diminished interest in things that you used to enjoy. And so you just have no get up and go to do the activities that you used to like. And so you end up being more shut in, if you will. Unintended weight loss or changes in appetite. And so this when we say unintended, it's not I started a diet and I want to lose weight. This is just happening because you have no interest in eating. And as a result, you end up generally losing weight, but it can be an increase in weight as well. With these kind of not feeling like doing anything, we talk fatigue and just general malaise. And again, I think I word it as not having the get up to go. So the ability to concentrate, decision making, these tend to decrease or deteriorate when we're talking depression. And then when we get into things like guilt, and stuff like that, this might actually lead into suicidal thoughts or thoughts of self-harm and stuff like that. And so you get a wide array, and you don't need every single one. The criteria is, you need quite a number of them, but they need to be occurring all the time. And as I said, it's not transient or temporary like the change of a life event. This is ongoing. And so, if you're listening and you feel as though you have a lot of those, it doesn't make the diagnosis. It's definitely a precursor to you to go talk to someone. One of the things with depression diagnosis and these symptoms, they fit a number of medical conditions as well. And so quite often, it would not be surprising if you had various tests for certain organs, blood tests to see the levels of different things. The first thing that would come to mind is thyroid levels. As being depressed could produce a lot of these symptoms. And so you would want, what the physician would do is rule out a lot of things. So you might end up back at depression, but you want to make sure, mimic condition A, B, C, D, and E are all checked off and ruled out. And then you kind of end up at depression as opposed to landing on depression first and not doing a full assessment, if that makes sense.
Yeah, absolutely, Paul. And I'm happy you're going down this path because I just barely touched on some of that this week. I did talk about the PHQ-9 that it's not an assessment tool. It kind of help guide the physician through the process of prescribing and monitoring results from time to time. Um, but the key point here that I try to really stress, while in all medical condition, but very specifically, anything that has to do with your mental well-being, don't try to tackle this on your own. Do seek professional medical help, advice, and guidance for that. It is so critical because you can end up going down a path that you would, by far prefer not to if you had to, to choose.
Yeah, 100% agree. And your first discussion with these symptoms that I talked about, your general practitioner, and they might be the ones to get the ball rolling insofar as the blood tests that I said, or we'll say the organ function tests, things that if they're off, they'll produce these symptoms. And then they can lead you into, we'll say, the specialist or the person if that's where it ends up going, that can help you with this. And so that's kind of what goes into a diagnosis, and sometimes why it takes so long. You mentioned your be aware topic as primary versus secondary, and so I'm not sure that I would find this in literature. It's kind of something that I've just seen in the clinic setting more than anything, and it's the person, and you've met these people over the years as well. The person that comes in and that they have a diagnosis of depression. Sometimes, and with a lot of mental health disorders, there may be overlap, whether that's PTSD and depression, anxiety and depression. It's not uncommon. Yet another reason why you need to see a professional to see exactly where you're at with that. But you have the person that really is just coming in with that. And then the individual that is, like you said, suffered a debilitating accident, can't get out of bed or was bedridden for months. And never got back to their old normal, and now because this has been months or years long, the depression really has set in, and this person has experienced more a secondary depression or a depression as a result of this primary event. And so that's the only reason we'll say we're separating the two. The other thing is we tend to see differences in treatment, which we'll get to later on, insofar as success goes with cannabis. So, it's really nice that you brought that up. The other thing you mentioned is just a second ago with the PHQ-9, so a qualitative analysis, how I feel. That in and of itself, you'll get a score, and the score will relate to you're in the mild category or major category or whatever. It's not a diagnosis. Where we find this tool to be useful is when you're comparing to yourself. So it doesn't even work if Mark scores a 15 on it and I score a 12. We can't compare because we're in different mindsets. The way we would interpret each question would differ. And that would be across the board for the 9 questions, using this test as an example. Where it does matter, though, is when you want to evaluate treatment, and if Mark, you scored a 15 and I scored a 12, well, now we want to compare our results to ourselves. If we're feeling better, in theory, those numbers should reflect, maybe yours goes from a 15 to an 8. Mine goes from a 12 to a 9, whatever the case may be. But it becomes personal as compared to yourself, because generally you're going to answer the questions in about the same manner as you did the first time. And so qualitative assessments are useful for the individual only, but not comparing from person to person. I'm going to take a drink just for a second.
Yeah, for sure, Paul. Yeah, it's all good. And I know you're going to be talking about this a little bit more, but as it relates to medicating, how that should be approached, and that would be different in the case of depression as a secondary condition, where the doctor would need to look at, the primary condition, and treat that. As well as treating depression along with that. And let's not forget that one will compound on the other. And that could be both negative and positive, right? And I'm sure you have a lot more to say about that.
Yeah. And so, the person coming into the clinic or the person reaching out to their doctor, they're in the negative sense, using this as an analogy. And quite commonly, it's pain. And so we'll see, or the doctor will see a person that is on a pain pill for a condition. The pain pill may be helping to some degree. It's not curing the problem. The depression comes in, and then you start to see the same person that's on the painkillers now on an SSRI or SNRI. I'll explain what those are in just a minute. And so then you become treating two conditions from one incident, if you will. So often those individuals are the same one looking to substitute with cannabis. But I'll backtrack for just a second. Insofar as treatment goes, with depression, one of the go-tos is cognitive behavioral therapy. And I don't profess to be a professional by any means in this category of treatment, though I'm aware that it becomes what they're working on is a different way of approaching things, looking at things. So when we look at things like feeling guilt, it's approaching it from a different way, that maybe you're not guilty, and by approaching it a different way, you don't feel it so much. The same thing as the idea of worthlessness. And so it becomes a change in mindset is what they're attempting to do. You would work one-on-one with person, and this would go, it's not a one-day workshop and you're better. This is ongoing. And even then, as time goes on, you're given homework to do on your own based on your own personal situation. Again, another reason why it's important to talk to a professional, and so they can really hone in on where we'll say your issues are as compared to someone else. And so as the behavioral therapy goes on, selective serotonin reuptake inhibitors, or SSRIs, or SNRIs, so serotonin norepinephrine reuptake inhibitors, are common medications. And so if you've, in terms of SSRIs, if you've heard of Paxil or citalopram, Prozac, Zoloft, those are common ones in that category. And in the SNRIs, Effexor, which I believe is venlafaxine, and Cymbalta are common in that category. And so these are common medications, we'll say a pharmaceutical assistance to the treatment of depression. And so you track yourself down, you have the behavioral therapy, you have the medication, and people will have either interest in doing that or limited success in doing that if they've given it a try. And this is where they end up coming into the clinic looking as cannabis for an answer to that. And that's just either internet searches or discussion based with, I had a friend who told me about this, and we know this story. We've explained this story a lot. And then it becomes a discussion of substitution, because there are side effects to every medication, and some of these provide not pleasant ones as well. So that's kind of, if you will, the diagnosis part, and then what you would see in the treatment part. So the premise on these medications is your serotonin or your norepinephrine, your feel-good molecules, if you will, by preventing them from being taken away. So reuptake inhibit to the longer they stay out, hopefully the feel-good molecule makes you feel better. That's the idea behind it. That would also be the premise behind CBD, as we bring cannabis in now. And over time, we've seen a lot of success, people utilizing CBD, especially as part of their treatment plan. And the idea of this is to block the uptake of anandamide. Or the premise on how that would work is to block the uptake of anandamide, and that's our own internal feel-good molecule. And so that's where we see some success there. Uh, Anything to add there, Mark?
Yeah, Paul. Yeah, yeah. Have a sip of water there and clear your throat for sure. Yeah, very well presented thus far. A lot of knowledge, valuable information. Which, by the way, I've kind of prefixed um, this week session to be pretty much that. So I know that our viewers and listeners are not being disappointed by no means. Um, so now, having said all that, I just lost my train of thought. But no, you talked about introducing CBD, and and I talked about that yesterday. Um, but very quick, that many patients have found varying degree of relief with CBD. Um, but that, and we say this all the time, it's not a one size fits all. There's a lot of moving parts here with some of the medication that you've already mentioned, and how do they work together or not, right?
Yeah. And those are all fair points. And so we'll go back to the CBD part. It is not a one size fits all. I'll kind of bring in THC to the CBD THC question, and some will report benefit to their symptoms based on using THC dominant or THC only product, and you know it works for them. Like you just said, it's not a one size fits all. The one thing you want to keep in mind when you introduce THC is, and this is the other thing about getting a good diagnosis, the depression. If there's a psychotic element to it or psychosis element to it, and psychosis is essentially those times where we'll say you fall out of being in touch with reality. So whether it's hallucinations, delusions, we tend to see this in terms of schizophrenia as a psychotic disorder. Because THC based cannabis can produce some of these exact symptoms, really in the clinic we've always steered people with those conditions away from THC. If you want to give it a try, absolutely do it under the care of a physician, just because there is we'll say what the cannabis or the THC can do produces similar symptoms to what you might experience on a day-to-day or month-to-month basis. And so it's a huge caution, whoa, red light. You really have to discuss the risk reward. And so that's, when we say get a good diagnosis, if there's that psychotic or psychosis portion of it, THC, it's not for you. But I kind of gave the background to how CBD may work. Studies that I see, just to piggyback off your point, the not one size fits all, is you tend to have a bump up in mood right away. But that doesn't necessarily last a long time for the we're talking the straight depression person. We'll say more the primary condition as they're coming in, anxiety, depression, or they might see more benefit to the anxiety than the depression. The ones that, just looking in the clinic kind of as a global look or an overhead look, that have the best success is that underlying condition gets better. So that pain gets better. They're able to move around more, and that somehow lifts the mood and lifts where they're at. So are they really treating the depression? Well, yeah, but the treatment goes back to the primary condition. And that's why I don't know. Is that your experience too, Mark? You look around, the people with depression as the secondary seem to alleviate that symptom much more.
Absolutely, Paul. And I touched on that earlier this week. And I did mention even today is that when you're treating the primary condition, it can overlap and often will and compound on the depression aspect for exactly the reason that you mentioned. If that individual was either bedridden or really with very little mobility and unable to do chores around the house or do things that they enjoy doing, and that could be playing with the kids, that will play, a role on your mental health. Who's kidding who? So if you're able to treat that condition that allows you to do that, it's going to compound and by all means help the health and the mood condition for sure, the mental health. Yeah.
So, having said all that, as put your finger on the treatment or treatments, after you get your good diagnosis that you want to undertake, and whether or not that includes cannabis, this works. This will be I don't want to steal your thunder for the rest of the week, but especially as you begin different therapies, journal. Write down how you feel. Get an idea of how you feel. Get in touch with your feelings on how you feel. You know how you feel now, but you really want to evaluate is, especially if you start a couple of things at the same time, whether it's the behavioral therapy, whether it's the SSRI or cannabis or however, get a feel on where you were to where you were at, hopefully in a better state, but even document that in a negative state because that's something you want to report back to your doctor. There's, from a pharmaceutical standpoint, multiple medications that if A didn't work for you, they can always shift to B. One thing as I just bring up pharmaceuticals though right now, often these are medications that you can't stop abruptly. And so don't come in to a clinic or don't start a cannabis treatment on your own and stop your SSRI or SNRI on day one with the cannabis. These are really medications that you'll have nasty effects if you do that, generally speaking. And so you want to wean off of them, but do so under the care of the prescribing doctor. So go back to doctor. We'll say, Bob, I'm looking to get off my Effexor. How can I do that safely? They'll give you the directions for that, but make sure you don't do that on your own. Okay.
Yeah, very, very good point, Paul. By all means, a critical point, really, because you could be undoing what a doctor or yourself have been working towards for quite some time and put you in a spiral downward spin pretty quick.
Yep. So, lastly, I think cannabis in this type of condition becomes a tool in the toolbox, something we've said all along. And, these other forms of therapy, there are definitely merits to them. And it's not something you want to completely ignore or push off to the side and just get focused on the cannabis. Treat it as kind of, another tool in the toolbox. And so, really, if you have 2 or 3 tools, the benefits potentially are much greater. And the first person that comes to mind with regards to that was Joe in our podcast previously, and we've talked about him already. Plug podcast.weedwell.com. You can find it there. But he used cannabis to get himself to a place where he could still do the therapy. Tool in a toolbox, and so he had, we'll say, a 1-2 punch and found himself in over time a much better place.
Mm-hmm. Yeah, that's right, Paul. Paul, I'm just wondering, you've covered a lot and a lot of valuable information. Again, that makes me feel great because I've really been pumping this up all week, and I know those that have followed that and are watching or listening today, that they're definitely not disappointed. For sure. So, Paul, any other key points, or are you at a stage of, just kind of summarizing today's topic?
The last thing that I would say, along with we'll say more the mental therapy to this, and this works for, again, when we're talking the primary or the secondary depression, as you start, maybe feeling a little better. We would talk about this in more be well stage. Things like yoga, you might never have tried before, and other mindfulness type activities, just to get you moving, in touch with your body, in touch with your mind. You may find benefit to that as incorporating a complementary medicine. That would be the last thing that I would add into, different tools that you can add into your treatment plan.
Yep. And Paul, if my memory serves me well, I believe that is Saturday's topic for me. So I will touch a little bit more on that.
Yeah. So, in summary, I think we're at the point where we'll wrap here. And in summary, depression is much more than being sad, or just having a sad period of a few days or even a few weeks, based on like a life event or something like that. It's much longer, much more consistent, and kind of, we'll say, in your face all the time. I read off a number of symptoms that tend to be in the mind, slowing things down, withdrawn, weight loss, and honestly, they're out there. But if you start feeling a few of these things, you want to talk to a doctor and initiate that conversation as soon as possible. As you notice it being ongoing. And the reason for that is to rule out different causes, different, more, we'll say, physical causes to the depression, and then get an actual diagnosis of depression and whether or not it has other facets, especially psychosis and stuff like that, in there. And once you have that diagnosis, then you can really evaluate what treatment plans will work for you, whether it's a cognitive behavioral approach, a pharmaceutical like SSRI approach, or cannabis. And it's, understand, it's not an either or. It can kind of be all. As you try to get well. And again, I'll just say the cautionary part that you really want to question your use of cannabis, THC cannabis, if you have that psychosis element in there, psychotic element in there, and it's just because the cannabis, the THC, can produce some of these symptoms. The risk reward is not in your benefit, so really consider that. But get a good diagnosis, evaluate your treatment plan, and journal how you feel, would be the three kind of take-home points.
Paul, I'd like to also add that, depression and all the other mental illness conditions that you've mentioned, they are a medical condition. And we hear that they're certainly not pleasant, but nothing to be ashamed of. It is a medical condition that in most cases can be treated as well. Do speak to your doctor about that. If you need the assistance of a specialist, ask your doctor to direct you in that path as well. So, that would be my words of encouragement for those listeners, or a listener that a loved one is suffering from one of those conditions, to share that with them.
Really, sorry, Mark.
Well, you go ahead, Paul.
Really document how you feel, and it's an excellent point, because you know what? If you cut your arm and go to the hospital, they put stitches in it because they can see the cut down your hand. If you're feeling these things, no one can see that. We're dependent, or the professionals are dependent on how you feel. And so the greater you document or have an idea, or when it happens or when it occurs, the better picture you paint that same cut on the arm that we can see, you're going to paint that picture for the physician. And so you're 100% right, Mark. It's a medical condition. It's just one that requires you to describe more than someone can see.
Yeah. And be open about it. Do talk to people, even those that are close to you. Express how you're feeling so that they understand how you're feeling and they know where you're coming from. That they may not put other additional pressure on you, understanding better where you're at. And by all means, your family doctor is a good place to start. But don't keep to yourself. Do share, do talk, and seek help is the best overall advice that we could give.
Yep.
So, Paul, I'm kind of looking forward already to next week's topic, which I did my homework this time and I looked ahead, and it's risk factors. What can our viewers and listeners expect next week, just in a nutshell?
Yeah. So we want to talk risk factors in terms of modifiable and non-modifiable risk factors. So we'll spend some time identifying what that is, and then the time where you really want to, or the place where you really want to focus your efforts, things you can actually change or alter, we'll say, your trajectory of health or trajectory of wellness, whether if you do it or avoid this activity, or thing. And we'll get into a lot of detail on things you can do to help yourself in that manner relating to the risk factors.
So I'm personally looking forward to that, Paul. It'll be another great session and a great few days leading into that session. So I'm looking forward to that. Now, I just want to remind viewers or listeners that have just joined us or joined us midway through this, you can see, the full episode by, going to our YouTube channel. And if you're someone that prefers podcasts, in about a week from today, you can go to podcast.weedwell.com and you will find this episode in the podcast, along with many, many others of our knowledge and learning sessions where Paul and I have a similar session. The ones that involve Doug as well, where we kind of summarize our month and the activities and the highlights of the month. But also in there, you'll find many patient testimonies, people that share their stories that you will likely find one that will resonate with you, and at the very least, they will be inspiring. So I encourage all of our listeners to go to podcast.weedwell.com for those. So, Paul, I guess for you and I, it's to next week, and I am really looking forward to it. Um, So for myself here, I'd like to do my wrap up. But before we do that, I want to mention that next week, or pardon me, tomorrow being Friday and Saturday, we're going to be talking a little bit more about depression and how that might relate to you or to someone else. So, for example, on Friday, you can join us at weedwell.group for additional information. And as Paul touched on already, journaling your path day to day and look for trends or changes to how you feel and what your mood is like. So that's Friday. And then Saturday, time to consider complementary medicine to assist in dealing with the root causes of depression. And Paul touched on that as well. Now, Sunday is a special day. This is one that is really dedicated to our listeners and audience, where you get to ask your questions, bring up your topics, send them ahead of time so that we can review them and talk about that on Sunday. So, lots to look forward to. And now for my wrap up and disclosure. I'd like to remind our audience that these information sessions are intended for individuals who are generally in good health and generally well adjusted, that are functioning effectively and are not in need of medical treatment, including treatment for mental health disorders. These information sessions do not involve the diagnosis or treatment of any medical or mental disorders and does not prevent, cure, or treat any mental disorder or medical disease. Further, these sessions are not a substitute for therapy, for counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of a medical professional. It is your responsibility to seek independent guidance from medical professionals to the extent that is necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. For those who have taken some steps in improving your quality of life, congratulations. And remember, your journey is your journey. And as long as you're taking some steps forward in improving the quality of your life, you should be very proud of the progress that you're making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. On behalf of Doug, who is not with us today, my colleague Paul, and myself, we look forward to the next time that you join us. And until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.